Karen Morgan, and I'm a doctor of physical therapy. I graduated in 1990 with my bachelor's and then in 2009 with my doctorate. My practice is a neuromuscular approach to musculoskeletal disorders as well as neurological disorders. And it's a very individualized and evidence based approach. In 1990, I started in pediatric neurorehabilitation and did that for a few years, and then went on to what I call big people orthopedics, adult orthopedics, and then from there went into home health for a good 10 years, and I was working in geriatrics. And then we moved up here, and I continued that for a bit, and then opened the practice after my doctorate. So in 2010, I opened the clinic.
So what's your target market?
There's a good question.
Yeah.
My target market it's pretty broad. So I work with kids, I work with adults, I work with individuals who have experienced pain that they can't get rid of, a lot of chronic pain, chronic injuries. I work with typical problems that you would find in physical therapy, but my approach is different. And what makes me different, again, goes back to that neuromuscular approach where I am looking at a lot of motor retraining. And I'm working with initially centralizing that control. Basically, I'm teaching individuals how to power their movement differently so that it actually is more effective, more efficient, and less prone to creating injuries.
What made you want to be an entrepreneur in a sense?
Excellent question. Throughout my career, I've been collecting the ideas of how I wanted to do physical therapy my way, or what was really working. And so I just kind of keep those in the back of my head throughout my career. And an opportunity opened up, a window opened up. Actually, one opportunity was taken away from me, and there was a necessity of, okay, how can I do this differently? I've always want to have a practice. Right now, this contract here has fallen through. Now would be the time to open up my practice. And so I think taking my approach of I wanted to teach people how to be independent. I think we create too much dependency in healthcare. So that was something that I saw lacking. I wanted to have an individualized approach that sometimes can be really difficult in some of your larger settings. I want to be able to spend a good 50 to 60 minutes with a patient for a treatment and a good 75 to 90 minutes for an evaluation, which is difficult to do when you're working under a certain paradigm that we tend to have in physical therapy. So I had some ideas of how I thought things could be done, if not better, definitely differently, and would match my personality too, and I felt would be a better service to my patients too. The big why is by nature, of course, we want to help. Those of us in this profession want to help, but why, how in this way? Part of it is back when I was looking for a career, that was like when I was in junior high and high school, I was actually thinking on that. And by the time I was a junior in high school, I realized, I want something that's going to challenge me, heart, mind, body, and soul. It wasn't enough to just serve. It wasn't enough to have something that was going to stimulate my mind. It wasn't enough for me to just be active. I knew all these things that I couldn't sit behind a desk. I knew I needed to be working with people, and I needed to be serving. I knew I needed a good a challenge, and this actually is that for me. And then why do I do it this way? I feel that having the personalization, the time, really is much more conducive. And we know this actually with in evidence-based practice. If you can spend time with one therapist, your outcome will be that much better than if you're being passed to different therapists. And we know this. Part of it is just the patient appreciates that more. And you have that sense of, well, he really knows me since he's worked with me now a few times, and now, if someone else picked up that chart and started treating me, you kind of wonder, do they really know?
What's your vision for your business and your practice 1 year from now, 5 years from now, 10 years from now?
10 years from now, can I be out in Europe vacationing? um, 1 year from now, I'd like to be, I really enjoy teaching. And I do actually work with interns from Western and Whatcom community. For those who are interested in physical therapy, they will work with me and observe, and I get to teach them about what physical therapy is in my approach. Like to continue doing that and doing workshops, but continuing to do what I do here. I'm not interested in growing a huge practice. That was never the vision. The vision was always that I would be able to deliver individualized, evidence-based, caring, compassionate, fun treatments that really optimize people's health. I want to teach people to be independent, to teach them how to be healthy and not have to rely on us healthcare professionals.
If a customer was to choose between your business and three others just like it, why would you suggest that they give you a try first?
You're going to have a bit more problem solving going on here, a bit more analysis. And, I would say in general, we physical therapists are a fun group of people. We enjoy people tremendously, so all that, but nevertheless, my paradigm of practice allows physical therapy here to be not just effective, but it's also fun. And maybe that's one of the reasons why it makes it effective too, is you're enjoying the process, which is helpful because when you're in a lot of pain, making something actually enjoyable takes a great deal of, well, that's some skill involved there. There are more of us out there that are trying to do individualized because we're tired of working what we call the mill, where you're in a big practice and you do have the overhead and you only have a certain amount of time with your patient. And of course, I do have to budget it, but I'm going to budget it at 60 minutes versus 30 minutes. And so that allows you to really, one, be able to get to know the patient and really see things that are contributing to the problem. It's very difficult to analyze and come up with a solution if you really don't take the time to look at all of the different components, and those can come out in the hour. And I can't tell you how many times a patient will tell me, like midway in, oh yeah, and I forgot. Did I tell you that I had a stroke and a blah blah blah, or something that was huge? Or by the way, I was in a motorcycle accident, 10 years ago. Does that play into this at all? That comes out at minute number 32. And if I had sent them out the door at minute 28, I would have missed that piece of information, which would have been, oh yeah, well that's going to play into this. So having that time allows me to gather a lot more detail, and also having the time allows me to ask the question, what's going on here? I love to ask that question. If something happens during a treatment that the outcome was not what I was expecting, I will sit back and I'll tell my patient, this is the look of me thinking. I'm quiet right now because I'm wondering what's going on here. And I'm not afraid to say that in front of a patient. I know I don't have all the answers. And I'm always trying to ask the question, why? What's going on here? What's making this happen? And why would that be? And then work with the patient and explaining, well, here's my train of thought. Here's what I think is going on, and here's why that's contributing. So I like to teach my patients the process that we're working at together. And that's the other thing too, is I look at us as a team. I really look at us as a team. And so I rely on that team member to give me that information. And also, we work together. One of the big problems in physical therapy, I think, as I'm reading through the literature, is compliance with a program. You've heard about that patient compliance. Oh, and how many times have you heard maybe a friend say, yeah, I'm not doing my PT exercises. I don't really have a problem with that. I mean that I have a high rate of compliance with the program. And here's why. If you came in and you said, I didn't do the exercise over the weekend, and I would ask, well, Jordan, okay, so what's going on? What happened over the weekend? And you tell me, well, this is going on. And And I had friends coming in from out of town, and we're doing this. And so I'm like, okay, that's cool. So you got a full life. So what we want to look at is how we can make this work for your life. And I have my optimal program, and then I have the program for someone who wants even more, and then for the person that can really only handle a few, we're going to work with that. And then we'll work with also your schedule of where we can put those exercises in, how we're going to do that in a pragmatic way. I like to work with functional exercises, as I call them, things that you can do at any place at any time. So when you're washing your hands, you're remembering to, work with the core, squeeze the bum, work with the shoulders back and down, and generate that power correctly as you're washing your hands. That's one way of doing it. If you're reaching for that door handle, remember to actually generate it from here, bringing it out this way versus just throwing and actually just using an extremity that's not well powered by your core. So I can teach functional exercises that way, and then also when to do your exercises, when's an optimal time, and then also planning on how to plan that into your schedule, even thinking about that the night before. So I do also a lot of um, life skills training. There's a little bit of life coaching going on. If things aren't if someone's struggling with the program, we'll figure it out. I am about making this, doing my best to help you succeed at bringing better health into your body and reducing that pain and achieving the goals that you came to see me for. So I will do almost whatever. I'll do anything. Stand on my head.
Right.
I will do a lot to make sure that my patients can succeed, and generally they do. Well, I just I'm grateful for my folks, and that they paved the way for me in a way. And just I watched how they practiced medicine, and I I saw how it could be done, and so I think that planted the seed. And then as I've gone through, so it's what this will be how many years? 28 years that I've been practicing, and through the years I have watched. I've always been a watcher. I just watch what people do, and I kind of analyze, and I sit back and I ask questions. And so I've got a bit of introspection, and I've always wanted to still go back and give what my folks gave, and they gave their hearts. Um, they really served their patients. Served is really the word. They served them, and so much so that when a patient would move out of state, they would still come back and see my mom and dad every year to schedule an appointment. And having that kind of loyalty tells you, you know, that patient felt valued. And that's what I want to give to my patients as well. I want them to know that I value them, um, that their well-being is highly important to me, and that I am committed to helping them achieve better wellness for sure.